All right, just welcoming everybody as you are joining tonight's webinar on depression, coping with the inevitable ups and downs of life. And I'm just going to give about a minute and a half for everybody to arrive in this virtual room. Again, welcome to anybody who's joining tonight's webinar. This is co-hosted by Healthy Planet and Now Foods. So I'm just going to wait about a minute for everybody to get into this virtual room. And okay, I always like to reward those who are on time. So let's get going. I'm going to, before I get into the webinar, just a few important housekeeping things for those of you who are here to learn. You're in the right place. And some of you may know me because I've done quite a few of these webinars already for Healthy Planet. But my name is Talia. I'll more formally introduce myself in a second. Co-hosting with me tonight, I have Alex. You can't see him, but he's in the background and he's going to be monitoring the chat. So if you have any general questions, you can feel free to ask him. But if you have questions about the topic tonight that you want me to answer, please put those in the Q&A area, not in the chat. So at the end, I will be going through the Q&A and answering all of your questions. So please make sure to do that. And the chat is where you can chat back and forth with one another. This is being recorded. It will be available permanently on the Healthy Planet YouTube channel. So if you miss stuff, you can rewatch it. So there's no problem. So that's it, really. You're going to get the recording. The questions will be answered at the end. Put those in the Q&A, and otherwise, hopefully Alex can help you with anything. If there's any technical issues, he's going to jump in as well. And otherwise, hopefully it's a smooth ride. Okay, so let me get started. I do like my laser pointer. So tonight's topic is depression, coping with the inevitable ups and downs of life. And it is co-sponsored, as I mentioned, by Healthy Planet and by Now Health Canada. So just a quick little bit about Now Health Canada. We are a 55-year-old, I think maybe it's 56 now, very old, older than me, a family-owned company. And that's quite unusual in and of itself. A supplement company. This is our core family and a founder. It's actually a fascinating story. You can get this free downloadable book or PDF at nowfoods.ca, where you can look up anything that I go over tonight as well. But it's called Beating the Odds, and it's a great story if you want to know about Now. And as for myself, just a very quick introduction. I'm Talia Charney. I'm the Nutrition and Health Education Manager for Now Foods Canada. I'm also an author. As you can see, I do love to write. And I also like to show my training values because I do hold those dear. And hopefully those come out this evening, especially the nuance. That's probably my favorite part. Now, I always give a disclaimer. That's not just because I have to. Sometimes it's more important than others. And tonight I would say it's really important on a topic that can be very serious like depression. So keep in mind that this presentation is for informational purposes only. So nothing I say constitutes the practice of medicine or any other healthcare profession. So no doctor-client or patient relationship has been formed. And keep in mind the use of information written here or stated here or materials linked or even my questions answered at the end. Those are all at the user's own risk. Of course, I do my best to be thorough. You will see that. The content of this presentation is not intended to be a substitute for professional medical advice, diagnosis, or treatment. So do not disregard or delay in obtaining medical advice for any medical condition that you may have, and of course seek the assistance of healthcare professionals for any such conditions. I'll be giving you lots of great information, and you can take that to a trusted healthcare provider who knows you and use it in a way that's appropriate for yourself. So I want to start with a background in depression because if you understand some of the concepts, it makes all the material to follow that more interesting. And this is not going to be a surprise to anybody, what I'm showing you here, that there's been a lot of issues with depression or mental health during COVID, and I think still continuing. I've felt it, many people have felt it. So it's a very topical topic, be redundant there. And so there's no, this is the reason that I chose it, especially around this time. And I want to say that depression isn't just being unhappy, because we all are unhappy about certain things. We all sometimes unhappy and sometimes happy, but it's really a more of a complex mood disorder. And it's defined by not only a despair or sense of sadness, but two important things to that, just so that you even notice it in yourself or somebody else. It's persistent and it impairs life. So you can't work, your relationships suffer, it can be very overwhelming. And I don't expect you to diagnose it, but I did want to show you, this is the diagnostic criteria, just to highlight a few things. Firstly, that one of these two things has to be present for someone to be diagnosed with it. And that's either the depressed mood that's most days and most of the day, or a markedly diminished interest or pleasure in things that usually you enjoy. Like I, love playing piano. All of a sudden, you don't want to do that anymore. But then along with that, there's at least 5 or more of these symptoms in total have to be present. And you can see it's all over the place. It can affect your weight, your appetite. You sort of have a slowing down physically and mentally, loss of energy, feelings of worthlessness, guilt, issues with concentration, indecisiveness, and of course, not to forget that, recurrent suicidal ideation can be a part of it. And this is very serious. And I do have an important slide on that coming up, probably the most important slide of the night. And hopefully, if you feel you're depressed or you know someone who's depressed, you're seeing someone who's going to run you through a proper diagnostic process. What will happen if you go to see, say, a medical doctor or even a naturopath? They may grade your depression, and based on that, it's going to be treated differently. There's, mild, and then there's to severe. And drugs are not automatically recommended in every case, but they certainly would be for the more moderate, severe to severe. And so when it comes to natural supports, sometimes they can be used as a standalone when we're, dealing with some of the milder forms. Sometimes, based on the studies, your practitioner might find it appropriate to combine something natural along with your medication. And so it's going to be different in every case. This is really important that I experienced this firsthand from someone when I was in high school, that people don't readily disclose when they're depressed. Unfortunately, there is that stigma and other reasons. But what I remember is when I was in junior high school, there was a lovely young lady. I would describe her as the most cheerful person I knew, although I didn't know her well. That's what I would thought of her if someone asked me. And I'll never forget the day that I heard she had committed suicide. So you just don't know, especially in these times. Reach out to people, be more aware. It's a big thing. And this is the most important slide. This number for the suicide crisis helpline actually just changed a few days ago. They made it shorter and easier. So put this in your phone. Take a flash with your phone, 988, very easy to remember. And if you know anyone or yourself who you even suspect might need this number, don't be shy to share it. Find a diplomatic way. You can sort of say something like, well, look, I'm not saying that you need this, and I don't know, but I just readily share this with anybody who I just feel is down, because you just never know. Some way to say that so that that stigma is not there, but try to share it on your social media or otherwise. That's really important. Now, in mainstream medicine, there's typically two things going on when it comes to treatment of depression. For the most part, one is going to be sending you to some kind of therapy, psychotherapy, whatever, psychologist. And on the other hand, prescribing a medication, sometimes and not always. And typically those medications, just to give you a little bit of background, because when you research some natural products, you'll find them pointing to some of these same things. But there's certain chemicals in our brain that these medications target. We still don't fully understand depression, but these are the most common ones that are focused on. Serotonin being the big one, it's sometimes just referred to as the happy hormone, but they're all more complex than that. And norepinephrine and dopamine. So I just want to give you like a little bit of a taste of what each one of these does in the body or how they affect us: serotonin, norepinephrine, and dopamine. So serotonin is a nice way to think of it. It's the here and now chemical in our brain. And that's why I put the picture of meditation. It's a chemical that kind of is related to our interoception, looking inside, a feeling of contentment, a kind of an inward feeling. And we know it regulates appetite and sexual desire and function. It's been a huge focus of many drugs, and it is released in areas of the brain, and then it spreads out and affects many areas of the brain as well. So it's thought to be key for our mood, but not only serotonin. Then there's dopamine. Now, you might associate dopamine with addiction or Parkinson's, but it's not only, it's a normal chemical in the brain. And in contrast to serotonin, think of it as more future focused. It's out there, like this lady you can see, she's running towards something. So it's the molecule of more. I like this particular expression. I think there's a book under that name where I got it from. Pursuit, pleasure, pursuing, perceived pleasure coming. It's about what's out there, motivation, anticipation, and it's very much more outside of the body, exteroception, compared to serotonin. And those are both important parts of our mood. It's also released in different areas of the brain and spread out, infecting different areas of the brain. So that's serotonin, our inward and contentment, and dopamine, our kind of pursuit and pleasure. And the last one, norepinephrine, that's kind of related to a part of our stress response. And you might think, oh, well, that's just bad. But stress is not good or bad. It's just the dose makes the poison. We need a certain amount of stress to be at a good level of arousal or alertness or attention that's appropriate for the situation we find ourselves in. If we are so, unalert and can't pay attention, then we kind of get lethargic and, to the other end would be comatose. So these are all important parts, and where all of these chemicals happen to be in the brain and also relative to other things is going to affect how we feel. And so if you look at, I'm going to take sips of my tea throughout here. If you look at prescription medications, these are some more kind of old school, not used as much, but MAO inhibitors or tricyclic antidepressants. The newer generation drugs, SSRIs, are probably still the most prescribed, and some more current ones. But what they mostly have in common is the targeting of serotonin. That's the, here and now. Some of them also target dopamine. That's the, pursuing, the motivation, and norepinephrine, which is for that focus and in part stress response. Some of the older ones, because they targeted multiple ones of these, were more apt to have side effects, because when the more things you target, the more side effects. And so that's why SSRIs became more popular, fewer side effects, but still side effects. And some of the newer generation ones, like Wellbutrin here, actually don't even target serotonin at all. And the reason for that is because we're figuring out as we go, it's not all about serotonin. Serotonin issues don't fix everybody. And, as we're learning, there's more to depression than even these three chemicals. Now, the success rate for prescription treatments for depression is about 60%. Still not bad, but it's not helping everybody. Some people are treatment refractive. You may be one of them, so you just don't respond to treatments. And what will happen then is different ones will be tried. There's a dropout rate for SSRI drugs, which is the most commonly prescribed, of about 30%. And that may be because of common side effects listed here, or perhaps that it just didn't work. So I'm here to expose you to some other possibilities that, again, you can take to a qualified healthcare provider with some information and help them help you in a good way. Now, you might be aware of this, I guess it was kind of expose hot off the press very recently in 2023. There was a review of the evidence of SSRI drugs, and how it was really framed in the media is, well, we've been wrong all along about these drugs. Serotonin doesn't really work, and et cetera, et cetera. They're kind of very oversimplified. So I would say that more the best evidence that we have right now suggests that there's no clear link between just these low serotonin levels and depression. And that's true. There is no clear link, but that doesn't mean that serotonin plays no role in our mood. In fact, I would argue, I'm sure that it still does. It just means we don't exactly understand how. I'll give you an example. Let's say you have two people and they have the exact same levels of serotonin that's been measured, but one is depressed and one is not. What can be happening, just as in theory here, is they both have the same levels of serotonin, but when serotonin provides an effect, it does that by binding to a receptor. It has to bind on to something. And some people have more receptors or less receptors. So it's not just how much serotonin you have, but are there receptors there? Do you have a lot of them? And some of those receptors are more welcoming. Hey, come here, bind to me. And some of them are not. They're more resistant. So that's why it's just more complicated than simply low serotonin. If it was that easy, we could maybe have figured out a way just to measure your serotonin and then easily just give you the drug and everything will be better. But we know it's not, and we're still seeking new theories. So this is Dr. Andrew Huberman. He has a great podcast. And I like this quote from him. He said, maybe our term depression is too big a bucket, and depression is actually many different biological disorders, and only a subset of those are helped by SSRI drugs. I think it's a really valid statement. And for example, he mentioned, this is just one emerging theory about depression is inflammation and how it affects depression. A great example of that seems to imply that was there was an early treatment used for hepatitis C. It's no longer used, but this drug was actually pro-inflammatory. Increased inflammation sounds weird, but what they found was that almost all the users of this drug became depressed on the drug. And so there was the thought of, a link between maybe inflammation and depression. It seemed to affect their mood. It seemed so. And here is a meta-analysis. So that's when they look at a whole bunch of studies, so 35 studies, and notice some interesting findings. Common to all of these were that in people who had elevated markers of inflammation in the body, and you can measure them, those who had elevated inflammation, this often predicted a poorer response to antidepressants. So again, it's an interesting link. You have more information, you might not respond as well to antidepressants. And so I'm going to show you some natural supplements where there's some growing evidence that if you reduce the inflammation with them, it may help with depression. So my starting point in this journey was I went to examine.com, which is a wonderful website to look at peer-reviewed clinical studies. They only deal with clinical studies, not mice or rats or cells. and they review the studies, and they are not affiliated with any supplement company, so they're non-biased. It's a great website. Unfortunately, you have to pay to have full access, but I highly encourage that, and I'm not paid to say that. I just love them, and I'm grateful for them. But I pulled from them when it came to depression, the supplements that they had listed. They rated quite high quality in terms of the evidence. A is at the highest, and then B. And this is not in comparison to the quality of the rigor that you have for drugs. That's not possible. And then all of these are rated as having a moderate outcome, which actually is pretty good because I've looked at dozens and dozens and dozens of studies on natural products, and usually it's only minor. So moderate actually is pretty good. So I'm going to be covering all of these. And there was another great resource that I got, which I'll be returning to. Just lucky that hot off the press again in 2022, just last year, this international task force of 31 leading academics and clinicians got together from 15 countries across the globe, reviewed recent data from 2019 to 2021 of evidence for natural treatments for depression, happened to overlap with all those ones that I'm covering. So that's those two great resources I'm going to use. And just before I jump into the supplements now, this slide is, although I'm only doing one, I'm not going into detail on these. I could have done a whole hour talk on the 5 pillars for healthy mood, but I want to say they're no less important than anything I'm going to talk about tonight. I just didn't have the time to do it all. These things, you know, as someone who has dealt with a lot of clients over the years for different things, the pillars of health are essential, whether we're talking about for sleep or for mood or for anything. If you don't have these in place, it can be difficult to pull you out of anything. You will always have a better reaction or better response to drugs or natural supplements when you address these. Sunlight and fresh air, so important. Nourishment, so eating a well-balanced diet. You can ask me some general questions about this at the end. I have no issue with that, even though I can't go into it. I'm just putting very generally here, talk therapy. We all need to bounce our issues going on in our head off somebody, hopefully a professional, whatever way works for you. That is really important, really key to not treat depression alone. It shouldn't be a solo journey. Movement, I didn't want to put exercise because that can be a threatening word, but movement in whichever capacity you can do it. Anything that is doable every day is the best thing for you. And rest and recovery, which means, good sleep and just not overdoing it. So let's assume that those are in place as best as you can, or that maybe you can work with a life coach or personal trainer. There's so many different people out there that can help somebody move through all of those journeys. But now I'm going to go into the supplements. Okay, so starting with St. John's wort, I had to start with this one because it's literally I would say the most well-known in herbal medicine depression-related natural treatment. It's just, it's very well known. So here's the task force I turned about and their take on St. John's wort, which didn't surprise me at all. One, they said the evidence is very good for it, and the strength of the recommendation is also very good. It has a long history of traditional use by herbalists dating back 2,000 years. And they recommended it as a monotherapy. Most of them, they don't. A monotherapy meaning that St. John's wort can work as a standalone without anything else and is quite effective for mild to moderate depression. So keep that in mind when I say those. It's not for major depression. That doesn't also mean it's going to work for everybody, and you can say that anything I mentioned tonight, not everything works for everybody. But a really important thing about St. John's wort, and you'll see these on any product, you're going to look on the bottle, you always see the risk information. Never combine it with medications, at least not without running it by someone who really understands. That could be a pharmacist or your medical doctor. I find sometimes pharmacists know more about the interactions. They can look them up because unfortunately, St. John's wort interacts with many drugs. So you got to be careful with that. And here for St. John's wort, just very new, there was a 2023 review looking at 14 randomized controls. So I wanted to look, what is the more recent evidence covering over 2,000 depressed patients? And their conclusion was, our research supports the use of St. John's wort as it reduced the number of depressive patients and their HAMD scores. So that's just a common way of measuring depression, the Hamilton Depression Rating Scale, while having fewer risks and side effects than conventional medications. So St. John's wort is a really good option for people to, again, a qualified healthcare practitioner, but not to be combined with medications. That's not to say that a well-qualified person, say such as a naturopath, cannot slowly wean you on something while working with a medical doctor to reduce something else safely, but it has to be done with somebody who knows what they're doing. And here's an example of a really great comprehensive support with St. John's wort. This is called Mood Support. It's got a lot of ingredients, so I'll just explain a few highlights. One is that this is a virtual B vitamin in here, and the B vitamins have many roles that are related to mood directly or indirectly, so that's important. It has St. John's wort in here. That task force mentioned that St. John's wort needs to be a standardized extract. So this is a standardized extract, standardized to what's considered the chemical that has the activity that helps with the mood. And in purple here, I'm highlighting, these are, can't go into too much tonight. Again, you can ask me at the end, but these are ingredients that may be more related to our anxiety in a sense. GABA is a chemical in our brain that has a calming effect, so more calming. And it's not uncommon, I'd say almost always, to have depression go along with anxiety, like kind of hand in hand. Sorry, just silenced my phone there, little ding. So that's mood support, and St. John's wort again is I'd say, strongest contender tonight in terms of evidence and history. But again, not appropriate for everybody, depending on medications they're on. I will show you other things that we don't have to worry about interactions with medications as much. When you're rewatching the video on the recording that will be done, you can look at some of these. I won't read through this whole slide, but I wanted to show you the risk information on the bottle of this product just so that you can see there are lists of some medications it interacts with. You do have to be more careful when going out into the sunlight because St. John's wort has a sensitizing effect, so you're more likely to burn. Maybe not so much of an issue right now as we're going into the winter in Canada. Always for pregnancy and breastfeeding, that's contraindicated. Okay, so that was St. John's wort. Now on to our next. This is one you might not have heard of, less likely to come across when it comes to looking at mood. So it's SAMI for short. Now on our label here, which might be a bit confusing, it says helps reduce pain associated with osteoarthritis because some ingredients have multiple personalities. This one does. It's been studied to be helpful for arthritis, but also for healthy mood balance, which is what I'm going to focus on. So you might see that written on other products. Just depends what they picked, but it's the same. It's SAMI, SAMI. So you don't have to worry about that. And it's prescribed in Europe for osteoarthritis and depression. I just wanted to show you SAMI because, well, it's an interesting molecule, but if you haven't heard the buzzword of methylation, now you have. So SAMI is the body's most important methylator. What is a methylator? Just very simply put, we have these groups on a molecule called a methyl group, and a methylator is something that's very generously donates its methyl groups. It's just giving away methyl groups left and center. So that's what a methylator is. And SAMI don't worry about this big mess here, but this is a chemical pathway in the body. SAMe is part of that. And what SAMe does, more than any other chemical in the body, is it is a big giver of methyl groups. So it's involved in something called methylation. And methylation is important for many things, but one of those is for the metabolism, the making or breaking down of those chemicals I mentioned to you already, serotonin, dopamine, and norepinephrine. And that's how it may have a link to our mood, because methylation is part of that. And this interesting study showed that, or noted that 1/3 of depressed people that they looked at seemed to have methylation issues. And they measured their cerebral spinal fluid, which you're not going to be able to get at an average lab test, but found that they had low SAMe levels. Here's another interesting bit of information about SAMe. In this review, they said antidepressant treatments, so we're talking about your basic conventional antidepressant treatments, may lead to a depletion of SAMe's concentration in tissues, which may be replaced by the administration of more SAMe. So what they're saying is that taking some of these prescriptions may result in a reduction of SAMe, and that can be replaced by taking it. That seems obvious, but what's implied here is that, and other discussions I've seen, is that maybe some of the side effects or non-responses or poor responses to a medication in some cases could be because of this. And so there have been studies where SAMe has been combined with a prescription medication and shown that the combination of the two was more successful than just that drug alone. So that's interesting food for thought. So what did the task group have to say about SAMe? One thing they mentioned is, unfortunately, as a supplement, it can be unstable, an unstable compound. It's unstable, it may break down and be useless before we get it into the body. Luckily, there are technologies to stabilize it. I will show you that with a supplement when we get to it, but they're saying it's important, I guess, to have a stable form. Higher doses may be potentially effective, is just a mention of that too. That is relevant in the sense that SAMe, of all of the things I'm showing tonight, is definitely more expensive in terms of a supplement. But if it works, it works. So the higher doses makes it more costly, more capsules. That certainly, though, for some people may be a factor. And acceptable safety data, caution for those with bipolar disorder. Let's say bipolar disorder, caution to anybody. Everyone should be seeing a specialist, but especially with bipolar disorder. And that is mentioned on the bottle, not to use it if you have bipolar disorder. It may worsen some of the manic episodes. So here is a quite recent 2020 systemic review looking at 8 double-blinded randomized control studies done on SAMe, looking at over 1,000 subjects. And the general conclusion here was SAMe used as a monotherapy, so by itself, or added to another antidepressant, has shown encouraging and generally positive results. That's good. On this is Psychopharmacology Institute website. I just found a bunch of information. I'm just showing a little bit. They kind of summarized the use of SAMe. It's been used in studies both orally, intramuscularly, or even intravenously, but in your case, it's probably going to be just orally. And the doses and studies have ranged from quite low to quite high, but it's generally accepted that around this amount is maybe going to be helpful for some. Most studies showing it's more effective than placebo. It's always important to compare it to placebo. There are more than 50 clinical trials, so I'm not going through them. And some of them show it having equal efficacy to tricyclic antidepressants, which are the older generation. Maybe some people, I'm sure, are still using them, of antidepressants. So here's SAMe, now has 2 versions, different doses. But what I wanted to point out is, so one of them is our older version here is enteric-coated. And the second one says stabilized. And in both cases, these are just different solutions to stabilizing that SAMe so that it doesn't break apart. And so that's for its efficacy. And again, yeah, there are different doses. If we're looking at what seems to be the best doses for most people when it comes to depression, probably the SAMe of 400 milligrams 3 times a day is going to be more effective for most than the lower dose. And here's some of the risk information on the bottle. They're highlighting bipolar disorder and always pregnancy and breastfeeding. And, you know, it's consult a healthcare provider about other medications, because Health Canada can't have us putting, you know, long lists of medications on the bottles. All right, so now this one may be one that you've heard of. If you've done research on depression, it's kind of we got more buzz recently. So one of the newer, garnering a lot of interest. I love saffron as a spice. Use it to make tea. It's this beautiful red, fragrant spice, and you probably associate it maybe with Iran, but it's also found in Spain. And it has a history of use in traditional Chinese medicine and Persian traditional medicine as well. So not only for mood. You'll see on our bottle, it says helps to maintain healthy mood balance. That's because there are a lot of studies, mostly out of Iran, on depression, some on anxiety and other things as well, but the huge bulk on depression. And we're still trying to figure out how does saffron work, but there's thought to be a couple of maybe key active ingredients. One of those gives it the color. I'm going to show you a supplement that is standardized to crocin. So that's thought to be one of the what we call bioactive, the chemicals that naturally exist in the stigma part of the flower that may have an effect on mood. You will see some products out there with a focus on saffronol. But I also want to point out that in this whole stigma, because it was traditionally used not as an extract, they didn't standardize it, they didn't have that technology, they would probably just use it as a whole. There are many compounds naturally existing in the stigma that also may be accountable for the effects on mood. And a lot of those you'll find actually in a health food store today: rutin, quercetin, hesperidin, you know, all of these. So at least 150 natural compounds. And now has a product that actually is an extract of the whole stigma with all of these compounds and is standardized to the crocin, which is quite unusual to find. We don't know fully how it works. I found information suggesting that it works on the dopamine pathway, which, as I mentioned, that's the outward thinking, the pursuing, or on the serotonin pathway, which is a more inward and contentment. So it could be either, and there's theories about other ways that it works as an anti-inflammatory, working on that's kind of like I'll call our stress axis. So we don't know for sure. What did this review have to say about it? Well, one, acceptable safety data. Secondly, and I'm going to elaborate on this, there are quality issues with saffron. And this is because saffron, if you've ever bought it, tiny little bit, it's very expensive. So whenever something's more expensive, there's a higher incentive unfortunately, for cheating and, doing things in an underhanded way. And in terms of their overall recommendation is that it's provisionally recommended for a monotherapy, so as a standalone, or as an adjunct used in mild to moderate depression. So as an adjunct, meaning adding it on to another medication. There are studies combining it with medications. There are studies as a standalone. And this is a systemic review on saffron. Saffron had a large positive effect size when compared to placebo for depressive symptoms and anxiety symptoms. And their conclusion was Saffron could be an effective intervention for symptoms of depression and anxiety. And then they're mentioning, there is some publication bias, etc. Always often the case. So when I went to examine.com, which, as I mentioned, great website for just clinical studies on natural supplements, they summarized a lot of the clinical trials on saffron, but certainly the highest evidence is for depression with a notable effect, very high consistency of results. So it's very promising, effective for major depressive disorders. Compared to reference drugs. So it's been compared to different reference drugs used for depression. You may or may not know some of these. And there are many systemic reviews, but I would like to note, even though it's not on topic for tonight, interesting, even though the evidence was lower, a strong effect for hot flashes. So, never, you never know. That could be the next big thing for hot flashes. Now, as I mentioned, quality issues. So historically, saffron is the most adulterated commodity due to its high price. Adulterated meaning we're sneaking in other things, or it's posing, it's something else completely disguised as saffron and being sold. So you really got to be on your guard. What Now does, and they have their own, they've got 8 labs and very high tech facilities, is they test for all these 3 different natural chemicals that you would find in saffron in every batch. Because if someone is going to make a fake saffron, what they will tend to do is get a synthetic version of one of those chemicals, put it into something that's not saffron, and then just test for that. But it's very expensive and unlikely for them to go to all the trouble to put in 3 of those natural chemicals found. So that's a good way of making sure that we're dealing with the real saffron. And so, as I mentioned, this saffron is a bit of a higher dose than you'll see mostly out there, 30 milligrams. And the reason for that is because it actually took us years to get this, so we were a bit behind on the market, on the trend, because we were trying to find a whole stigma that was good enough quality to also be standardized to the active ingredient. And so we managed to do that. And so that's a really great accomplishment. And just on the label here, so and also note when you're reading the labels and risks, pay attention to that. You'll see usually 2 different things. One is a do not. So that's a clear, don't do this, period, end of story. And then you'll see a consult a healthcare practitioner. So consult a healthcare practitioner doesn't mean do not, or that you can't use it with, this or that drug. It means consult someone who understands and knows about interactions and can properly advise you to how, whether or not you can take this safely. So it's just saying that you need to take that important step. All right, so on to omega-3 fatty acids. I'm sure you all know what these are, and but you might not have thought of them in the context of depression. So again, our great review here, or the task force, what did they have to say? So they recommend as an adjunct, so on top of other therapies, highly, but don't recommend it as a standalone, although I did find opposing opinions to that. And I want to tell you a bit more about, because many of you probably already take fish oils, but what really do you have to look for specifically? It's not just any fish oil. So here again is examine.com, and they're looking at all of the evidence on fish oils for different mood-related issues. Major depression was where it shined the most, had notable effects. So that's a strong endorsement. They say may not work for minor depression. But the most important part is that in fish oil, there's different components of it. I'll show you on a label. The important one seems to be what's called EPA. So if you're looking at a label, and this is just a label of any fish oil you pick up in the health food store, you're going to see the total omega-3 fatty acids, and then you're going to see that broken down into EPA and DHA. So the emphasis is on EPA when it comes to depression. That's what the evidence shows. And so you can read that on your particular product. But then I'll give it to you even more specifically. Now, this is a close-up of, I'm showing you a particular fish oil that's a high potency, because this would be closest to what would be appropriate if we're matching most of the studies for depression. Because now has many other fish oils, but this is the highest potency. And what has been said about EPA, if you're looking for something that matches the evidence the best, is that in that supplement, the EPA should be greater than 60% of the total. So in this case, EPA is a whole 66%, and the DHA is 34%. So that checks off. And in a dose range of 200 to 2,200 of EPA in excess of DHA. So you want more EPA, basically, and that checks out as well. So this would be an example of a product that matches that kind of a high EPA to DHA ratio that would have been used and found most successful in these studies. And then in terms of, well, how does fish oil help with depression? I already mentioned that anti-inflammatory, the fact that we've already have emerging evidence that there might be a relationship between inflammation and depression. So fish oil is well known to have anti-inflammatory effects, other effects as well. That's probably the strongest suspicion, but we don't know. And in terms of the doses, so it has been tested at a range of EPA doses. In this particular review, the positive outcomes occurred only at high doses of 4 grams a day. So 4 grams a day is not the kind of dose that's, what you need to meet your daily requirements like you would be eating fish. This is more using fish oils as a drug in a sense of these kind of high doses. So you got to keep that in mind. These doses are not recommended on any bottles in the health food store because it's above what Health Canada would typically recommend. So it's kind of like a, an off-label use. And so good to run by a practitioner if you're going to use a dose that's off the label. Even though fish oil is very safe, like our fish oil has no risk factors written on it, but when you're going into the higher doses, there's a little bit of potential for blood thinning. So if you're on a blood thinner, this is definitely something you want to run by your doctor. All right, next, curcumin. Sure, you've all heard of curcumin, probably the most well-known supplement, generally speaking, out there. Curcumin or turmeric, you might notice. So this is turmeric. It's a spice used in Asian food, a lot of, say, India, Pakistan. It's a yellow dry spice, but this is what the root looks like before we get the, just remove the water, and then you have that lovely powder. It has a long history medicinally, and of course it's used as a spice. It's even used as a coloring agent. It's been written about in ancient texts. You can see here in the 2nd century CE in Ayurvedic medicine. And the active part of the turmeric root, which gives it that lovely yellow pigment color, is what's called curcumin or curcuminoids. So when you buy a supplement, you don't usually buy something called turmeric, but it's usually called curcumin because they've taken the curcumin out of the turmeric and concentrated it. So what did they have to say in this task force about curcumin? This is just very, very emerging evidence. So I wasn't surprised that they didn't have a ton to say in terms of evidence. So provisionally recommended, potentially a good add-on to somebody who has inflammatory disorders in the first place and depression. So that could be, inflammation is widespread. If you have a chronic disease, often you have inflammation, whether it's an autoimmune disease or diabetes or even just obesity. And then they mentioned, so formulations with evidence of sufficient bioavailability are advised. So what that mumble jumble means, translation is, they recommend that you use a kind of curcumin that can absorb properly, from your mouth and make it into your bloodstream. The reason they're saying that is curcumin is actually very, very poorly absorbed. So many companies develop all kinds of different technologies to try to overcome that. If you're just buying a regular curcumin extract that has no technology applied to it, it's very poorly absorbed. If you're eating it in a turmeric and the whole spice, you can enhance its absorption by what you combine it with in your diet. But so if we look at the reviews for curcumin and depression, there was one in 2017. They looked at all different kinds of evidence, a few human trials and many other different kinds. They say, although not uniformly consistent, the bulk of evidence is positive for curcumin as an effective antidepressant and anxiolytic agent, that means calming, for people with major depressive disorders. Okay, so that's interesting. And then in a recent one, and these infographics are just showing all the different ways in which we think curcumin might be acting on mood. So these are all theories. This is a more recent review, and they say to date, a handful of clinical trials have been published and suggest a benefit of curcumin in major depressive disorders, with evidence that is progressively growing. So hopefully it will keep growing. I'm sure it will, because there's literally thousands and thousands of studies on curcumin already to date, all sorts of areas. And so this may be a nice consideration for someone who has inflammation that could probably be combined, not with all drugs, but certainly with many medications that you're already on. Again, you have to check the bottle, you have to check with the pharmacist for that potential added benefit. So here is a 2020 meta-analysis. And they looked at, again, a whole bunch of studies, 10 studies. There's not a ton yet for depression and curcumin, 10 studies. A range of doses were used. This doesn't tell us much because with curcumin, I think the form of it is more important than the dose, because it can be so poorly absorbed. You can use a high dose and barely absorb anything. The types of curcumin used in the studies were inconsistent all over the place because it's, again, processed different ways. But all in all, they say, added to standard care, it might improve depression and anxiety symptoms in people with depression. And so I'm showing you this particular, there's quite a few different curcumins even that now has, but curcubrain is what I wanted to bring to your attention, because this curcumin, particular one, has been altered so that it changes its absorption ability, and has many, many studies to show that. One, it's the only one that I know of, that I've heard of, that has been shown to cross the blood-brain barrier. So when you're dealing with things that seem to be brain-related, such as mood and depression, it seems only applicable to use something that can cross the blood-brain barrier. I'm only showing a very tiny few here of studies that they've done. They've done many, many, not all related to mood, but here are some related to, tension, anger, confusion, stress, mood, memory, calmness. And the second thing that I put here, that's an interesting detail for those who are kind of more savvy and looking at different products. They have proven that most of the curcumin that you ingest of this curcubrain, the ingredient in here, the trademark ingredient, is called Longvida. It's been shown that when measured in the blood, it's mostly in its free form. So curcumin, if it's free, can cross the blood-brain barrier. If it's not free, it's attached to something. What's usually happening when it's attached to something is your body has flagged it as something foreign to get rid of, and it's on its way out, and so will be ineffective. So sometimes, or in many cases, you'll have comparisons of products that are actually not really valid, because all they're showing you is how much curcumin is found in the blood. What we really want to know is how much of that is in its free form. And It's rare to see that information. So this is a positive. All right, and I think this is the last one. This is a real outlier, but I like it. I actually use it myself, not for depression, but for, you can see here, it's marketed as a sports product. So this is another emerging potential off-label use for a product that has, is very well known, creatine monohydrate in the sports world as something to help with building muscle and strength. But it has other interesting uses for mood. So just to describe creatine in a simple way, think of it as a battery. What is a battery? A battery is just stored energy, potential energy, ready to be used. Creatine is the same. It's like a backup battery. So when we need extra energy that our body doesn't have, it can be converted into ATP. If you haven't heard of ATP, it's like our energy source in our body. Everything that happens in your body, every reaction, not every, but many reactions rely on ATP, energy. No ATP, no energy, no life. And if your ATP is very low, you may feel literally low and sluggish. So it's a backup energy. How does that relate to depression? So there was a 2019 review. There's growing evidence from human neuroimaging, looking at the brain and genetics and other areas and animal studies, that disruptions in brain energy production, storage, and utilization are implicated in the development and maintenance of depression. So, maybe sometimes our mood is affected by low energy in the brain. So that's interesting. What did our task force have to say about creatine? Whenever we have something emerging, they say not currently recommended. So obviously you're not going to use this in place of, something else. This could be a good add-on, or for someone who has not been recommended a drug. You have maybe very mild depression along with fatigue. So it's kind of more of a trial thing. There certainly are some positive studies, but the evidence is not yet huge or overwhelming. But what they say is it may have a role in people with depression and comorbid fatigue. So those two are going hand in hand. I'm thinking of, like, let's say depression with chronic fatigue syndrome, depression with fibromyalgia, or just depression along with something where you yourself would define yourself as low energy. Fair safety data for sure. There's some warnings for people who have pre-existing kidney disease. You can see here there are studies, there are clinical trials, short ones. Here's one with women with depression, different doses as well, randomized placebo study with a positive effects. And there are others here. So, it's certainly, I think, we always have to think of each individual. If you have depression, a lot of fatigue, maybe creatine would be a good addition to what you're already doing if it's appropriate for you and safe for you. If you've got depression along with a lot of inflammation, then maybe, curcumin or fish oils could be promising as an add-on or standalone, again, depending on your situation. And here's the risk information for creatine. Again, this video will be on the Healthy Planet YouTube channel going forward, so you can come back and look at some of these if you need to read them through in detail. But also, if you just go to nowfoods.ca, you can find all of these. You can find the uses, contraindications, and all of that. But this is definitely what I call off-label use, which is certainly in mainstream medicine, they do off-label use all the time, where they take a drug that was tested for one thing and use it for another because they find that it happens to work for something completely different than what they studied it for. And now, because some of you may have joined late, and because this is a important topic or serious topic, depression, I do, before I take questions, want to repeat my disclaimer, or just mention to go back and look at it, that nothing here tonight was intended to be a substitute for professional medical advice, diagnosis, or treatment, including the questions that I'm going to answer at the end. So please do your due diligence to make sure that you work with somebody who knows you well, whether again, medical doctor, naturopath, or somebody else, and who understands, knows how to diagnose depression and can deal with you appropriately. And that is a wrap. Okay, so question time now. So I just want to remind everybody again that I will be looking at the Q&A area. So please, if you have been putting questions in the chat for me, at this point, go and rewrite them into the Q&A area so that I don't miss them. And hopefully, like Alex has been looking out for that and helping moderate the chat there. Thanks, Alex. So I'm going to go and have a look at some of the questions.